Hi, this is Dr. Gary Sykes, and I'd like to discuss with you in this vlog the topic of anxiety in pregnancy. It's a huge problem. More and more pregnant ladies today are very anxious. Historically, this was not the case. I remember going back pre-internet when, yes, there were some pregnant ladies who were anxious, but the majority of pregnant ladies were not. We did not have the same degree of anxiety amongst pregnant women as we have today. I did not have as many women coming along to me saying, I'm under the care of a psychologist for anxiety. I've got a history of anxiety, on medications for anxiety. I did not have pregnant ladies where I had to so often refer them to a psychologist mid-pregnancy because of anxiety. Anxiety has become a massive problem for patients because, well, it's a problem in itself, but really it disrupts their enjoyment of pregnancy. I mean, a woman can't really enjoy her pregnancy if she's extremely anxious, and I get very upset about that because usually what they're anxious about never becomes a reality. So they're wasting a lot of mental energy, causing a lot of mental stress, not sleeping well, all sorts of things about things which don't ever come to fruition. Now, I'm just wondering the background of this. Well, it's not just pregnant women. There's increased anxiety in the communities. There's been a gradual increase in the incidence of anxieties generally. Yes, it's got worse since COVID, but it pre-existed COVID. Certainly, it's become a problem since the internet, since social media. Social media, I believe, is the key factor in this, and it's making it a lot worse because there's too much information out there, most of which is a nonsense that women can't filter. So in pregnancy, they go to these different forums, chat rooms, websites, and they get information about topics that they just want to know more information about, or they could be anxious about, and that information does not allay their anxieties but will compound it. I always tell patients, please don't Dr. Google. I have never found that going to Dr. Google allays anxiety. To the contrary, I found it makes anxiety worse. So certainly if you are a more anxious person, don't spend time Googling information. Indeed, it's interesting because the women who are not anxious don't spend very much time at all on the computer checking things out. The women who are anxious spend the most time. There's a direct correlation, and that going to the information on the website just makes it worse. I tell them all the time, don't worry until I tell you to. I'm extremely experienced. I would have managed well over 10,000, probably even now 15,000 pregnancy. That is huge. So I know this stuff. I know what I'm doing. And I tell patients all the time, don't worry until I tell you to. If I'm worried, I'll tell you. That's when you should worry. But I'm not worried. Why should you worry? So please don't worry. But also, I make myself very available to my patients so they can ask me questions. They can put the things that they worry about to me, and I can allay their anxieties. Obviously, you've got the telephone, but then you've also got email, and you've got social media. Facebook is very popular. I have a personal Facebook site just for the practice. People who are not patients are not allowed to be my friends. I've got well over 1,000 friends, and they're all patients. And my patients all the time are sending me through Messenger all sorts of questions. You know, can I eat that? Can I eat that? Can I colour my hair? Can I do my nails? It goes on and on and on. They're just sending me questions, and I'm sending out a reply, and this allays their anxiety. So I strongly encourage that amongst my patients. As well, I have an extremely comprehensive website. Indeed, my website goes way back, the information goes way back to before the internet. And my website is got hundreds of pages, literally, of information on all sorts of topics. So please go to that, and all you need to do is put into the search the topic, and up will come relevant information that you'll find very, very helpful. And that's continuing to expand. That's available not only for my patients, but for anybody. And I've had people contact me all over the country, over the world, who have found my information very, very helpful in allaying their anxiety and answering their questions. So I strongly recommend that you do that. But please, I want you to enjoy your pregnancy. And you can't enjoy your pregnancy if you're very anxious. So please turn off that anxiety gene, relax, have fun, and look at a very positive future. You're going to be soon cuddling your beautiful little baby. That's what it's all about. Pregnancy is a journey to achieve a goal. The goal is cuddling your baby, and I want you to enjoy it. So please don't be anxious, and contact me if you've got any concerns. Bye for now.